Now, for next condition which we'll be discussing this evening is the DRUJ. So DRUJ, the full meaning of DRUJ is what? Distal Radioulnar Joint. So dislocations could occur at this joint, and that's what we're actually trying to look at it. So you can see that here there's a fracture. So a fracture also led to what? Dislocation. Do you understand? So of course you can see that the bones can cross each other easily because they are dislocated. So a distal radioulnar joint dislocation is just a rare but it's a significant injury. Now it involves the joint that is far down, between the radius and the ulna. Okay. Now the joint is very important for your forearm rotation. For you to turn your hand like this to the front, for you to turn your hand at the back. So what is it? Dislocation of the ulnar head from the sigmoid notch of the distal radius. It can occur isolated or in parts of complex injuries like Galeazzi. This is a Galeazzi where there's a fracture and dislocation. It could be what? Essex-Lopresti injuries. This one, there's kind of like what? A tear in the interosseous membrane that is in between this ulnar and radius bone. Okay, so you can see it, just a dislocation of the distal radioulnar joint. So types of dislocation, it could be dorsal, where the ulna dislocates towards the back of the wrist. Do you understand? Okay, is this dorsal? Okay, or volar, dislocates towards the palm. This should be volar, okay, because it's going down. So it's another dislocation. So causes is fall on the outstretched hand, direct trauma to the wrist or forearm, rotation injuries during sports or accident. So symptoms is pain and swelling at the wrist, limited ability to rotate the forearm, a visible deformity or prominence of the ulnar hand. Then when the person tries to grab something, the grip is very weak. Okay. Then diagnosis is X-ray, CT scans. Okay. Treatment, sometimes you just want to stabilize the dislocation. You understand, where you are not using any operation. Then sometimes you want to actually do operation to actually check out for ligament repairs, then stabilize the bones further. So that's what we have for the DRUJ dislocation.